Hello, and welcome to a Health Podyssey.
The pandemic unemployment assistance program, the expanded eligibility for people, say, in the gig economy or with varying work histories, is extremely important, and I think really points towards where unemployment insurance should go.
I'm your host, Alan Weil. In response to the COVID-19 pandemic, Congress passed the bipartisan Coronavirus Aid, Relief, and Economic Security Act, most of us know it as CARES, in March of 2020. Among the law's many provisions was an expansion of unemployment benefits, both the amount and the duration. Now, the federal benefits only lasted for a few months, which created a unique opportunity to study the effects of those benefits because they came and then they went. And what those effects are is the subject of our discussion today. On today's episode of A Health Podyssey, I'm joined by Dr. Seth Berkowitz, Assistant Professor of Medicine at the University of North Carolina, Chapel Hill. Dr. Berkowitz and co-author Dr. Sanjay Basu published a study in the February 2021 issue of Health Affairs. They explored the unmet health-related social needs of those who are affected by this change in unemployment benefits. Their findings are important and will set the stage for future policy discussions about how to respond to the COVID epidemic. Dr. Berkowitz, welcome to the program.
Great, thanks so much. I really appreciate being able to be involved.
Happy to have you with us today. So let's start with unemployment benefits and the CARES Act. Give us a sense of what policies were in place, what were changed, what went away. It's kind of a complicated picture, so why don't you get us started?
It is. It's very complicated, and it definitely took me some time to try to get a handle on it when we were starting to study these issues. I think it helps to think about what unemployment insurance looked like before the pandemic and then what the CARES Act did. So before the pandemic, people had a state-based unemployment insurance applied to particular jobs where you had to have a set earning history. You had to have been in those jobs for a set period of time. States would set the levels and states would set how long you can get the benefits for. It's run as a federal-state partnership where the federal government provides some kind of minimal backstopping, but really in a day-to-day sense is run at the state level. The CARES Act had three main components with relation to unemployment insurance that were really helpful. The names are all kind of, they use the same terms in different combinations, so it's a little bit confusing. But one of the components was the Pandemic Emergency Unemployment Compensation Program, which extended the maximum duration of benefits, so people could get benefits for up to 13 weeks beyond what their usual state cutoff would be. They also had the Pandemic Unemployment Assistance Program, which provided benefits to people with jobs that might not have otherwise been covered by this regular state unemployment program. So people who work, say, in the gig economy or very low income workers or things like that. And then finally, the focus of this paper is the Federal Pandemic Unemployment Compensation Program, or FPUC, which added $600 a month on top of whatever people's normal benefits from the state level programs would be. So whatever that level was, you just got a flat $600 per week on top of that.
And just to be clear, there's a long history of the federal government stepping in during recessions to bolster the unemployment insurance program because, as you say, it's state-based and state revenues drop when the economy goes south. But those historically have really been focused on, if I remember right, the first of those three. They extend the duration. But I don't think I've ever seen the federal government either say, oh, here's a whole new category of people who are eligible, or say, here's a whole bunch of new money on top of the state benefit. Am I right on that?
Yeah, so you're absolutely right that basically in each recession since at least the 1950s, the federal government has stepped in and expanded the duration. I think the expanded eligibility is fairly new. If I recall correctly, I'm not an expert, there was a small top off during the Great Recession, around 2008-ish or so, but it may have been on the order of like $25 or $50 a week, nothing of the scale that the federal pandemic unemployment compensation program had here. So this was really a historically very generous program with the FPUC, the $600, and a historic expansion in eligibility with the PUA program. So you're absolutely right about that.
Yeah, I do have some vague recollection of a small top off, but basically the typical federal role is to extend, and here we did, federal government jumped in and did a whole lot more. Okay,
That's
so
right.
I interrupted you.
No,
You
no.
said your focus here is on the third of those features. So say a little bit more about that one.
That's right. Yeah. So the way that these programs got passed was somewhat interesting. So they all passed as part of the same CARES Act, passed at the end of March 2020. The first two programs, the extended eligibility, the extended duration, and the expanded eligibility, were initially, as part of the way they were initially passed, went through basically the end of 2020. FPUC, though, ended in July 2020. So that created a situation where, out of this sort of multi-component approach to unemployment insurance relief, you had one of the programs that ended when the others continued. And so that presents sort of an opportunity to study it. And as you mentioned, since this is really a historically pretty unprecedented level of generosity, it seemed like a very important thing to study because many of the concerns about unemployment insurance programs, even before the pandemic, was that the replacement rates, the amount that are actually replaced for people, are fairly low and may not be sufficient to meet people's needs. This responded to that type of concern very directly. And so it seemed like a very policy relevant question, not only for what's going on in the pandemic, which of course is very important, but also about unemployment insurance policy overall.
Yeah, so let's just pause there because, again, I'm not sure our health-focused audience has a lot of experience with unemployment benefits. So the way the program works is you get a portion of your earnings replaced for a limited duration. And what the federal intervention here did was, as we've already talked about, both the duration and the level. And that extra money meant that, particularly for the lowest wage workers, the replacement rate was quite high, whereas traditionally, one of the things employers have pushed for is to keep the replacement rate low enough that it gives people an incentive to go back to work. We don't need to get too deep into that, but is that about the right way to think about this?
Yeah, no, that's exactly right, and I think you hit on two key elements there. One, which is that the overall replacement rate is often fairly low for people, sometimes well under 50% of what they were earning, depending on their wage levels. But also that with the $600 a month, $600 per week top off, people were receiving much more than they would historically, and in some cases even more than they had been earning while working.
Okay, so we've talked a lot about the program side. Let's go to the other side of your analysis here, which is looking at social needs, particularly related to health and mental health. So take us through a tour of what kinds of conditions were you focusing on to see whether or not they were affected by the federal law?
Right. So we looked at two what we call in the paper health-related social needs and two mental health outcomes. The two health-related social needs we looked at were one element of what we think of as housing instability. In this case, it was operationalized as what we call missing a housing payment. That could either be your rent if you're a renter, or your mortgage payment if you're someone who is in a home that you own but you're paying a mortgage on. And then the other was a concept related to food hardship called food insufficiency. This is similar to, although not assessed in exactly the same way as the concept of food insecurity, which may be more familiar to the audience overall, but again, is sort of a similar idea around food hardship, i.e., that you can't afford the amount of food that you need, or you're at least worried that you may not be able to afford the amount of food that you need. And so that may affect some of your behavior around food purchasing or nutrition and things like that. And on the mental health side, we looked at two validated screeners for common mental health symptoms. There's a screener for depressive symptoms called the PHQ-2 that looks at two items related to depressive symptoms, and one called the GAD-2 related to anxiety symptoms. So we looked at whether those were above a cut point that previous studies have found to be clinically meaningful. So overall, looked at whether people could make their housing payment, buy enough food for their family, whether they were very anxious, or whether they're experiencing depressive symptoms.
Okay, so drum roll, please. We have policy intervention, we have outcomes of interest. What'd you find?
So I think we found a couple things that are worth highlighting. One is that in this sample that we looked at, people who reported having been had their income affected by the pandemic, they had lost work, they had not yet restored the income that they had before the pandemic. We found fairly high rates of these needs overall. So about 1 in 4 people reported missing a housing payment. About 1 in 4 people reported food insufficiency. Almost 40, actually a little over 40% reported depressive symptoms above this clinically meaningful threshold, and about half reported anxiety symptoms. So this is a group that I think is badly affected by the pandemic. We found that those who reported receiving unemployment insurance benefits overall were doing better than those who were not. So they had lower rates of all these outcomes. But we also unfortunately found that after the expiration of the federal pandemic unemployment compensation, after the $600 a week went away, that the difference between those who did and didn't have unemployment insurance narrowed. In other words, it seemed like unemployment insurance was more effective during the period when the FPUC was active, and it became less effective when that $600 a week went away.
Okay, well, you've given us the first layer of findings. It's probably a good place for us to take a quick break, and when we come back, we'll dig into those a little deeper.
Before hitting the floors of Congress, health policy begins in the pages of Health Affairs. Stay up to date with the latest research and insights by subscribing to the leading health policy journal. Subscribers have exclusive access to Health Affairs research, ahead of print articles, and resource pages. Subscribe today by visiting our website at www.healthaffairs.org.
And we're back. I'm speaking to Dr. Seth Berkowitz about the effects of the CARES Act passed by Congress in the wake of the COVID-19 pandemic and how it affected people's unmet social needs and their mental health. When we went to the break, you started by saying that one of the key findings was just the high level of need and the high level of mental health strains. Just remind us, who are you talking about here? Because that's not a result of the program. That's the population that you studied as a whole. So focus us in. When you say a quarter of people were facing those hardships, a quarter of who?
That's right. Yeah. So what we tried to focus on is people who reported having job loss or loss of income due to the pandemic, who had not yet had their income restored by the time they completed the survey that we took data from this study for. That's the Census Bureau's Household Pulse survey. So these were basically people that we conceptualized as people who had lost their job, lost income due to the pandemic, and it hadn't gotten better again. They hadn't found a similar job. They hadn't gone back to their same job.
So basically what you're saying is that among those directly affected in employment by the pandemic, high rates of hardship, high rates of mental health strain.
Yes, definitely.
Okay. And then let's talk about the effects of the program. You said those who received the benefits did better, which is, of course, what we would hope for. Go a little deeper in what that means for how much better they were doing and what you think the implications of that are.
Sure. And I'll say an important caveat to all this work is, the Household Pulse survey was designed to assess a number of things. It may not have been exactly designed for this question. And so we do always have some, caveats around, well, how when we're comparing the populations, those who do and don't receive unemployment insurance, how comparable are those? And so I think when we talk about those in detail in the paper, and I think those are very reasonable things. But overall, it looks like people who, in this group of people who were affected by the pandemic in terms of an income loss, if you received unemployment insurance, and even after adjusting for demographic and past income and other characteristics that we could adjust for, if you received unemployment insurance, you were about 10 percentage points less likely to miss a housing payment. You were about 5 percentage points less likely to report food insufficiency, and you were around the same amount, 3 to 4 percentage points less likely to report these clinically significant depressive or anxiety symptoms. So at the population level, that's a fairly large difference between these groups, even after adjusting for the demographic characteristics that do differ between those who do and don't receive unemployment insurance benefits.
So at a basic level, you'd say if people have a little more money, they're less likely to have the kind of hardship you're measuring. You've done work not just on unemployment benefits, but broader examination of the safety net. Can you put some of these findings in the context of work you've done around income security, around food security as well?
Yeah, that's exactly right. So a lot of my research interest is really around how things like unmet health-related social needs, like food insecurity, or sort of more broadly, how insecure or insufficient income are related to poor health, and what we can do to improve health for people who experience this. And I think this kind of puts unemployment insurance up among those programs that are starting to have some evidence that they may be beneficial for this. Other ones that I put in that category are SNAP, the Supplemental Nutrition Assistance Program, EITC, the Earned Income Tax Credit, things of that nature that are really designed to support people through difficult times. I think unemployment insurance is a really interesting example because it's essentially, unlike some of the other programs, it's an example of what you might call social insurance, meaning that people pay into it during times when they're working and can draw down from those benefits during tough times. It may not be actuarial in the sense that people may not put in exactly the same amount that they draw out, as you mentioned, when we're in pandemics and a lot of people need to draw on these benefits at the same time, or just in a recession more generally, even if not in a pandemic that caused a recession, the federal government may step in and add extra benefits. But it overall is an approach to providing a safety net based on this sort of insurance principle. And I think what we're seeing here is that kind of thing can work really well for health benefits.
Now, there in the public debate and in the current debate about another round of stimulus, there's a lot of discussion of sending checks to families at levels that are pretty significant. Do you have any sense from the work you've done, sort of how do you think about the relative merits of something you just described as a social insurance program tied to employment, checks really designed to get money in the hands of everyone at low income? How do you think about the likely difference between those two from the perspective of health and social needs?
Yeah, I think these are really complementary programs. And so I think some of the discussion talks about, should we do one or the other? Should we trade off lower check amounts for more unemployment insurance benefits or vice versa? And I think that misses the mark a little bit. I really think they're complementary programs for this reason. One, I think you can think of the checks, which even though they went out the first time with an income cap at, I think, 75,000, that still reached a pretty broad section of the American population. I want to say there's something around 88, I've seen estimates around 80% or maybe even slightly more percent of households got a check. So it was, maybe not fully universal, but it's pretty close to reaching everybody in the US. But it was a flat rate. It wasn't based on earnings history. It wasn't based on what your previous needs were or anything, what you previously were making or anything like that. Unemployment insurance, in contrast, is to some extent based on what you were previously making, although the top off was flat, but the state level benefit is based on that. And it's kind of specifically targeted to people who lost their jobs, they're unemployed. And so I see these as really being complementary features. One, the checks reach people that unemployment insurance cannot. We know that through eligibility criteria, through backlogs in processing at the state level system, through maybe even just people not knowing they're eligible and not applying, that many people who did lose income during the pandemic may not have received unemployment insurance benefits. I've seen estimates that maybe only a quarter to a third of people may have actually received these benefits, even when they received unemployment insurance benefits, even when they lost income. So the checks reach people who aren't reached by that. They reach people in deep poverty who may not have been working beforehand and thus didn't have a job to lose. And so I think they just meet different needs in different ways and overall form sort of an overlapping way to buffer people in the course of the pandemic.
Now, you mentioned, of course, that you focused on the feature that went into place and then was it came to an end, but there are other elements that are still in place. Presumably at some point they'll come to an end as well. So what are the questions you have in mind with respect to those other features?
Yeah, I think that's a very important point. And so, the federal pandemic unemployment and compensation program ended at the end of July. There was this sort of temporary thing called lost wages assistance that maybe gave a few more weeks, although it was sort of sporadically enacted. And then, fortunately, at the end of 2020, FPUC came back at a lower benefit rate, $300 per week. That goes through March of this year, and then obviously any further expansions or extensions of that are under debate. The other two elements, the extended duration and the pandemic unemployment assistance, the expanded eligibility, were sort of continuously operative, but may end as well. But I think taken together, these three things do point towards where future reforms may go. And in fact, these are consistent with what past panels that had made recommendations about unemployment insurance reform had recommended even pre-pandemic, and not even considering that there might be a pandemic like this. I think the pandemic unemployment assistance program, the expanded eligibility for people, say, in the gig economy or with varying work histories, is extremely important, and I think really points towards where unemployment insurance should go. I think the nature of work in the U.S. is changing. It's not that everybody has a unionized manufacturing job, which was never really the case, but was sort of, a model that some people had in mind, where you might stay with this, good job with good benefits for your whole career. That was never the case, but is even less the case now. And so being able to expand some of the benefits to people in jobs, say in the gig economy, I think is really important. I think the expanded duration is very important. For many states, you may only get 9 or 12 weeks of benefits, and so that may not be enough time to find a new job. And there's some evidence that people taking more time to find a new job actually results in what's called a better match, meaning that the job that people find is one they stay in longer. It's a better fit to their skill level, et cetera. So being able to take a little more time, I think, is useful. And I think what we've seen around the benefit level is, frankly, that the replacement rate for many unemployment insurance programs pre-pandemic was just too low. It was not enough for people to meet their needs and support them during this difficult time. And I think if people are paying into a program during the good times, that when they do fall on hard times, they should be able to draw on a benefit level that's sufficient for them. And I think we have good evidence now that that's not money that's just going to be wasted, so to speak, or spent in ways that don't help people, that it's really money that can help meet people's needs in a way that is beneficial for them and beneficial for society overall.
Well, before I let you go, there's a long tradition of labor economists studying the employment effects, the income effects of these programs. But as you noted, you're interested in the relationship between them and health and meeting healthcare needs. Just tell me a little how you got interested in this as a topic for your research.
Sure. So, my research really, I think, was rooted in my experience as a primary care doctor. I'm a practicing primary care doctor still. I've practiced in safety net settings in many instances, and even when not in sort of formally safety net settings, I think just the nature of income inequality in the U.S. is that you're likely to run across people who have had their health impacted by low income. And so it just got me interested in the idea of what we can do to improve health for people who are experiencing low income. As you said before, a lot of my previous work has been in the area of food insecurity and in programs like SNAP and things like that, which I think are really important. And in this case, in the pandemic, with such a rapid rise in the number of people who are accessing benefits through the unemployment insurance program, it seemed like a really important area to look at, since it wound up having a big role in what our pandemic relief strategy was. I think there's sort of a myth that the U.S. pandemic economic relief strategy was inferior to those of many other countries. And I certainly think there are things about it that could have been improved. But I think when taken together, when you consider the checks, when you consider the various unemployment insurance reforms, when you consider some of the work on eviction moratoria and other things like that, our response was actually pretty good. And I think there's a lot to learn from here, both in terms of what we might do better next time, which of course there is, but also in terms of what went well that we can use to build a stronger safety net or sort of a stronger system of social benefits for people in the U.S. overall.
Well, it's great to get that perspective and to tie these two critical policy areas, income support and healthcare, together. Dr. Berkowitz, thanks for taking some time with me today and for writing this really interesting paper that we were so happy to publish. It's been a pleasure having you on a Health Podyssey.
Thanks so much. I've really enjoyed being on.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about a Health Podyssey.
Health Podyssey is produced by Health Affairs, the leading journal for health policy research. The team behind the show includes Patty Sweet, Jeff Byers, Julia Vivolo, Sarah Kolk, and Sue Ducat. Like the show? Subscribe to a Health Podyssey on Apple Podcast, Spotify, Stitcher, Google, or wherever you listen to your favorite podcasts. Thanks for listening, and have a great morning, day, or evening.